morning, everybody. I think it's the morning. I just came from an overseas flight, so I am catching up on time. But right now, I'm very excited to be standing here and share with you what we believe is the future gateway for access for patients to have regenerative medicine at their fingertips. We do believe that the future of healthcare is regenerative. This will be a major pillar. It's obviously being deployed into practices already today, and I think that the future is only going to be delivering more and more exciting ways for this to be done. The one element that I do want to reinforce is cell source matters. So regenerative medicine, we're not manufacturing chemical compounds in a laboratory. We're using your own cells or a donor's cells, and so the power of these therapeutics and these treatments are only going to be as strong as the cells that we have access to. The way that we approach this is making sure that a patient has access to cells. And so I talked about this this very conference last year, but for those that weren't there, we've developed a very simple kit that can collect a sample in physicians' offices of a patient's hair follicles and cryopreserve those follicles, freeze them down in liquid nitrogen so that those cells do not age. You now have a locked-in template of cells that you can use in regenerative medicine into the future. And then Acorn is very active in developing the actual use cases of delivering these cells back to patients, which I'm going to share the first of which that is in its early access period today. So the Acorn journey for a patient would really be about them getting collected. So I don't know if you guys can notice how that beautiful hair in image one, but I'm sure you guys can figure that out. You can collect those follicles, have those stored down. Some of them can go into a creation step, so you still have a repository of your own cells, but some of them are used to create a treatment. And in this case, what we have done is formulated a way to create a patient's own secretome in a bottle, and I'll get into what that totally means. So first of all, the biggest principal difference, I think, between us and a lot of other regenerative medicine approaches is that we focus completely on autologous cells, and we think that's extremely important. You know, extracellular vesicles, cells themselves, these all have MHC complex on it. They are going to be inciting an immune response if given to a patient that those actual materials did not come from directly. And so from that, we want to make sure that we are always delivering a patient's own materials back to them, whether it's proteins, EVs, all the way up to live cells. You have a lot of massive benefits by doing this. Really, the only complexity is you have to prepare in advance. It's not off the shelf. Once you have that done, that preparation step, then it can be off the shelf. The hair follicle is ultimately my favorite body part now. It is an amazing miniature organelle, I call it, that has a multitude of germ layers inside of it, so you've got a multitude of different cell types, an extremely high concentration of adult stem cells, mesenchymal stem cells, the same ones that we target in adipocytes and in bone marrow, and they can be accessed non-invasively through plucking the follicle. Of course, you can access them as well doing a hair transplant with the FUE, but it is really an amazing way, the simplest, easy way to get access to a patient's own diverse cell populations and stem cells. And so what we've done with that is we've taken those cells that we've been able to harvest and freeze, and now we've brought them into the lab and cultured those cells out where we can actually collect the growth factors, exosomes, the matrix molecules that those cells release off. And that entire population of materials that are released by these cells is called the secretome. It does include exosomes. We get about 5 billion on average per vial, and except these are completely autologous, created from that patient themselves. When you evaluate this compared to other things that would be autologous regenerative medicine, really the only other option is PRP. We have up to 34 times higher levels of these growth factors that are present when you compare it to what PRP drugs deliver. The other difference is that we're able to create a suite of these vials ready and off the shelf for that patient into the future. And so you're not doing a blood draw every single time you want to access that patient's own biologic material. And so we've tested this out very rigorously against PRP, and ultimately you have more of the good stuff, the things that are exciting, but also less of the bad stuff. MMP, some of the other things that we do find in elevated areas in blood and blood cell derivatives. The one thing that I am most excited about is we're actually going straight to the source in aesthetic regenerative medicine, to the cells that we're trying to treat. And so instead of trying to find access to areas that are similar, we're going to cells that are present and responsible for delivering this benefit to hair, to skin, and we're leveraging those exact cells. So that Venn diagram of the actual growth factors and what is important to those those tissues that we're trying to treat is actually spot on. So right now we're seeing this paired in a lot of different ways. As you see, regenerative medicine leveraged across microneedling for face and hair, after post-ablative laser treatment, CO2 and fractional, and then on top of that, post-surgery for scars. So we have extremely high fibronectin. Fibronectin is in the 30s, multiple higher than in PRP, and obviously laying down those collagen tracks is extremely exciting for recovery. We've been trying to bring a lot of rigor into our testing on this. In the world of regenerative medicine, I think is in need of a lot of scientific rigor that's applied to this, and so we have our Genesis clinical program to prove this out. We did complete a 50-patient RIP study previously, and I think I presented that last year, but we moved in after that year to test out the first wave of now 12 patients that have gone through a post-ablative skin recovery after ablative laser. And then now we have this open observational study where we've got a number of partners that are in this room today working with us to really have the largest data collection that we've seen in regenerative medicine of a topical application across skin, hair, and scars. So if you look at those 12 patients that went through the topical side, this is the data from the first 8 that have gone through, and we're adding the other 12 that just did this again. We ended up having a 39% improvement across look, and when I break this down, it's 4 zones across the back so that we could have a larger surface area and compare things. And we essentially had our product, the autologous secretome, versus a HA product versus a best-in-class product and a standard of care product in post-ablative laser treatment. Patients reported a 39% improvement in look, 63% improvement of feel over on top of what they experienced in their standard of care zone. But the one exciting part is this was a double-blind study, so the applicator as well as the recipient had no idea what zone was which, and yet they had a 12 times higher likelihood of selecting the Acorn zone as the favorite zone, both from a look and feel perspective. The interim data, because we're running short on time, I'm going to go through pretty quick, but we have started to collect from this observational study, and responses have been really exciting. We actually have, right now, people that have gone through both the microneedling as well as post-laser. The recovery has been extremely quick. As you can see, I don't know if you can see on the big screen with the coloration, but this is somebody that suffered from a lot of redness in their skin, and that completely subsided day 1 after a YAG laser. We had, I think we missed one, but we're missing one slide, but that's okay. So ultimately, there's been a number of patients that have gone through the study already on the skin side, both from laser and microneedling, and now it's opening up to hair as well, and so we're investigating that part of the study that's just launched, and hopefully next year we'll have a slew of more data to present. Acorn does partner with a number of different groups in this research pipeline, includes areas across skin and hair, but now we also have programs in orthopedics and going already in animal testing for joint care, as well as turning these hair follicle cells that we can actually cryogenically preserve into bone, fat, cartilage, neurons, pancreas tissue, even immune cells. And so we've accomplished all of those things to really demonstrate that Acorn can be this repository for your patients to leverage these cells into the future. Anyway, thank you very much. The one note that I will say that Grant and I were talking about very recently is there is a very interesting opportunity to participate on a investment opportunity with Acorn. And of course, this is the meeting of the minds of people in the healthcare provider side, the company side, as well as the individuals that are investing in this space. And so if anybody is interested in learning a little bit more, please come and seek me out afterwards, and I can share the imminent opportunity. Thank you so much, everybody. Really appreciate your time.